Welcome to Prescribing Lifestyle, the podcast that's all about empowering you to live your healthiest, happiest life. I'm your host, Dr. Avi Charlton, and each week we'll dive into the latest research, practical tips, and inspiring stories to help you optimize your well-being. From nutrition and fitness to mental health and mindfulness, we'll explore every aspect of lifestyle medicine, giving you the tools you need to make informed decisions and take control of your health. Whether you're looking into preventing disease, managing chronic conditions, or simply elevate your quality of life, Prescribing Lifestyle is here to guide you on your journey to wellness. So, sit back, relax, and get ready to embark on this transformative adventure towards a healthier, happier you. Let's dive in. Hello, welcome to another episode of Prescribing Lifestyle. Today, I have a wonderful lady called Angela Stanton. She's the migraine specialist. She's Dr. Angela Stanton, PhD. How I learned from her is I did lots of courses from Nutrition Network. I did the LCHF Ketogenic Nutrition and Treatment course, and I've learned a lot from her migraine lectures already. And then last year in 2023, in August, I went to San Diego to the Low Carb USA conference, and I met Angela in person. It happened to be her 70th birthday with our friend Tracy McBeath and Tia Reid, and we had a nice, wonderful dinner together. And I think she's a genius. She knows so much about migraines and actually nutrition and everything. She has so much knowledge, and I'm so keen to share her knowledge with you. So I've invited her to record this podcast with me. She's the author of the book, Fighting the Migraine Epidemic, Complete Guide to Treat and Prevent Migraines. I've got the book here. And she runs a Facebook group called Migraine Sufferers who want to heal by the Stanton Migraine Protocol with 17,000 members. I'm part of the group, and it's such an amazing group with so much advice. Angela's very, very generous in giving advice in that Facebook group. So welcome, Angela. Thank you for coming.
Well, thank you for inviting me. It's really nice seeing you again now remotely as opposed to last year in person.
Yeah, it's so much difference, but it's still good catching up.
Yeah, very good indeed.
Great. Thank you, Angela. Can you tell us a bit more about your journey, how you get into researching on migraines?
Well, it's because I am a migraine sufferer myself. So I spent my whole life fighting migraines, and the medications, of course, that are prescribed for migraine, they hit and miss, they don't work, or if they do work, they may have a lot of side effects, real serious side effects. And so it just become a priority for me. When I got my PhD at a late age, and so when I was teaching at university, I was full-blown migraines day and night. So my migraines sort of kind of increased over my lifespan. So I started with very few, and then it sort of kind of increased. And so by the time I was in my 50s, it was just tremendous. And I remember sleeping or taking two chairs together in my office in the university where I used to teach between classes. And I would take my triptan or whatever medications that I had. And I was just hoping that I would be up enough and ready enough for the next class to teach. And, teaching 300-400 students at a time in a lecture hall is not exactly very easy when you have a migraine. And so I had to quit because it was impossible. And I decided to dedicate my full time doing research on migraine. And so I started it about 15 or so years ago, give and take, full time, just migraine and nothing else. So reading all the articles, not just the academic articles within migraine, but other fields that connected, like mechanics, electronics, the functions, the physiological functions of everything, including biochemistry, physics, the basics, the real basics to understand how as little as a voltage gated channel may work. Wow. How does electricity work? What is that? Because we're familiar with electricity. I have light, TV, but how does that work? And how does it work in my brain? And so I had to basically start from the letter A and learn through the alphabet of all associated sciences for me to comprehend what a migraine actually was, and to use my own experience as a migraine sufferer, excuse me, to sort of kind of put together and connect the dots with what I felt versus what I read. And then I wrote my first book, which is no longer up for sale. That was just about me.
Mm-hmm.
And that's when I opened a migraine group as well on Facebook. So that's over 10 years old.
Oh, wow. Okay.
And so people started to come in and started to do what I did, which was really at the time just minimal, just adding salt to water and pulled some foods out of my diet, some carbohydrates.
Mm-hmm.
And everybody else was seeing improvements. And so this is how it all started. Because I
Great.
could see that it wasn't just me, it was other people too.
That's amazing. So can you explain just in layman's term what migraine is and how the electricity has got to do with migraines?
Sure. So actually, I was just talking to somebody today, and I think the light sort of kind of shown up in her head when I said, well, think of migraine as an epileptic seizure manifesting in a different way from a seizure. But it's basically the exact same problem as a seizure.
Okay.
But whereas a seizure, think of a seizure as a bomb in one spot, and it just sort of all the electricity goes off at once, and it activates all the neurons, and that's why you can see all the shaking and saliva and everything associated with the seizure.
Yeah.
Whereas in migraine, rather than all of it going off at once, it's a more controlled movement of the electricity from one neuron to the next. So it's a sequential movement from neuron to neuron going in a wave pattern, which is called the cortical spreading depression. But it's exactly the same thing, the same cause and the same problem, basically, as a seizure, just
Wow.
manifests differently. And so when we are looking at the brain, the complexity of understanding of what actually happens and how it happens is very difficult to explain and to
Yeah.
visualize, because you're talking about invisible neurons by the trillion in the brain. And basically what we are talking about is an electrolyte imbalance in the brain, in that there is not enough sodium or salt, not enough salt at the particular part of the neuron where salt would be necessary to start the electricity. And so it's very complicated to get into it, and I don't know how much detail you want to get into, but basically the entire problem is this: not enough salt in the brain at that particular place at that particular time. And so that region of the brain can't function. So this is why you see many times, for example, migraineurs will, for example, have droopy eyes, droopy lips. They may lose part of their function. They may slur. They may not be able to hear or see or comprehend. So the part of the brain that doesn't have enough electricity can't function. It goes down. And so the symptoms reflect what part of the brain went down. And that is all. And so what I had to find out is, why did the sodium go down? Sodium is 40% of salt. So sodium and chloride is salt. So what happened to the salt? Why did that go? How come there is not enough salt? And so this is where it started. So my first step in trying to figure out if I can stop my migraine was to take salt. And my migraines started to disappear. And so this was a connection. So how do you take more salt to get it into the brain instead of, say, into your heart or some other places? So there are some tricks associated with this. And so the actual cause of migraine, then, if you look at it this way, is basically what you eat and what you drink, because that is how salt gets into your body. And so looking at how that, how your nutrients and how your liquids that you're taking, and how your activities, daily activities, exercise, menstrual cycles for women, full moon, goodness what, weather change, how does that connect to this not enough salt in the brain? And so from that point on, it was very specific and directional in searching for this very specifically. And I just published a paper on this in the Frontiers in Nutrition, where I connected to nutrition and I explain how it works. But I'm explaining the whole of migraine in that paper.
Wow, great. That's amazing. So we've been told to not eat so much salt, and we've been told to control our salt intake. Do you think that's the cause of why so many people have migraines?
No, migraine is genetic. So just like seizure, you have to have the kind of genetic setup in your brain.
Hmm.
It's also that migraine comes with a different brain. Um, Migraine brain, if you read some of the articles, they sort of kind of removed a little bit from the migraine centric studies on medication. But if you look at the physiology, migraineurs are a lot more sensitive to certain sensory stimuli, such as light or scent and sounds. And so many articles have done experiments and have come to understand and also dissected animal brains who are said to have migraines. That migraine brain sensory neurons actually have more connections. So if you take a migraine sufferer into the same room as a person who doesn't have migraines, like you and I, for example, you don't have migraines
Oh,
and I do.
I don't have
So
migraines.
there you go. So we go into the same exact room, and there's a certain level of light, sound, smell in
Yeah.
that room. You and I go sense completely different environment.
Okay.
And so I have a lot more sensory neuron connections, not more neurons, but more connections among the sensory neurons. So from a particular light strength, I will take in a lot more because my connections are more. And so there's a lot more stimulus to my brain from the same light that you get
Hmm.
from that light. And so
Mm,
I actually use a lot more salt than you do in
okay.
my brain.
Yeah.
Okay. And so once you understand the anatomy difference, the physiology difference, and
Hmm.
also that on top of everything, the genetic part of migraine, in addition to having more connections between the sensory neurons, is that the voltage gated channels responsible for the transfer of sodium in and out of the cell and the transfer of potassium in and out of the cell. And the ATPase, sodium potassium voltage gated ATPase channel, which is a pump, which is responsible to reset the neuron to resting state after an action potential. Those are all variants. They're different. So in my brain, they're different from yours.
Yep. Yep.
And so this is also a channelopathy. That's the condition's name when your channels, voltage gated channels, behave differently. And
Okay.
so it's like a combination of multiple things that you're looking at. And so with this, my basically my entire world, you and I may be hand in hand, living in the same place, but I perceive everything differently from you. So
Yeah.
you can't have a migraine unless you have the migraine brain. And so it's very specific. And so migraine doesn't need to have a headache with it either at all.
Yep.
So you can
Yep.
have migraine without headache. And
Mm,
so it is like seizure. If you don't have that kind of a brain, you're not going to have it. It's not like that you can just have it one day and then not the next day
mm,
without some very specific difference to your brain from the normal or
mm.
what we consider normal.
A lot of my patients thinks migraine is just a very bad headache, but that's not the case, is it? It's
No, not at all. I mean, if I don't need to have a head pain going with my migraine, then we
hmm.
can't even define migraine by a headache. So, over 20% of migraines don't come with a headache.
Okay.
So it's a big percent, you know,
Is most or all the migraines genetics?
all of them genetic. So you can only have migraine. I mean, it's a name, right? So you can have headaches, you can have all kinds of other symptoms that a migraineur has
Hmm.
under different name. For example, irritable bowel syndrome is a very common, vomiting is very common, dizziness, tinnitus, Meniere's disease, vertigo, aura. All these things can happen in other conditions as well. It doesn't need to be in a migraine. But when you put it all together, and you look at how it manifests. So take, for example, the seizure, as I explained.
Yeah.
Seizure also can have, or they have all the same symptoms as a migraine does, but
Yes,
they manifest completely differently
that's right.
when they actually come in with a seizure. So you can tell that, okay, that's a seizure, that's not a migraine.
Yeah.
So you can tell the difference, even though the symptoms are exactly the same. So migraine encompasses a lot of the symptoms that other conditions also have. For example, if you have a meningitis, which is a brain condition, a disease that you can get viral or bacterial, you will have the
Yeah.
same symptoms as migraine.
Yes.
If you simply have really serious hyponatremia, meaning not enough sodium, and
Hmm.
you're in the hospital as a result of not having enough sodium, you may have the exact same symptoms as a migrainer, but that doesn't make you into a migrainer. It just says that you have now a hyponatremia. But if you read my article, I describe that in many cases, a hyponatremia, a definition of hyponatremia and how it manifests, the symptoms are exactly like that of the migraine.
Yeah. Yeah. Great. So, in your Stanton protocol of treating migraines, it's diet and electrolytes. Is that the main thing?
Right. The very main theme or main thing that we have to focus on is the electrolytes. And
Mm,
so by electrolyte, I don't mean, the kind of electrolyte you can buy like Gatorade
mhm.
or the element T is a very common element.
Mm,
The particular solution that you can put into water and drink it.
yeah.
I'm not talking about those because neither of those is truly an electrolyte. They contain elements that have nothing to do with what a migrainer needs, such as potassium or magnesium or sweeteners, that kind of stuff. And so what I'm talking about as electrolyte is simply just salt and water.
Hmm.
And so that would be the prime importance. And so you asked a question earlier, which I'm not sure if I addressed about the salt
Mm,
of how much problematic it is. And salt doesn't cause high blood pressure. So that's not actually a concern.
hmm.
If you have cardiovascular disease and your vascular system can't dilate as a result of you have very strong inflammation and
Hmm.
your vascular system, your blood vessels, veins, and arteries are really stiff and they can't dilate when your blood volume increases, then you're going to have a problem from salt because salt with water is going to increase your blood volume. So that's
Mm,
actually the goal. Migraineurs, all migraineurs, when they're not medicated properly or at all, they'll have very low blood pressure. And so
mm,
that's a low blood volume. So by increasing the blood volume, we actually help migraine. And in fact, a research article that I incorporated in my paper
hmm.
discussed that migraineurs in before a migraine, which would be the prodrome, the
Mm,
preaxial state, and
yeah.
during the migraine and after the migraine suffer hypotension rather than
Wow.
hypertension. The normal would be hypertension for an average person. When you feel sick, your blood pressure will rise. For
Yeah.
migraine, it will drop. So everything is totally opposite. So salt itself not only that doesn't cause hypertension, but it actually helps migraine sufferers. So we have to distinguish people, right?
Yeah.
So
Yeah.
if you're not a migraineur and you are eating a really heavy inflammatory diet,
Hmm.
you should not be taking salt because
Okay.
then in that context, the salt is going to increase your blood volume. And if your blood vessels can't dilate, then you're going to increase or experience hypertension. And if in your brain, it may even lead to intracranial hypertension, which will increase the
Hmm.
pressure inside your brain. And there's no room, so that can cause serious problems. So everything has to be looked at in context. So
Mm,
if I'm looking at the
yes.
migraineurs, over 17,000 migraineurs now, not one has hypertension. Now, there are a couple of them who have hypertension, but that's from medications that they're getting. So when
Oh,
they're
right.
tapering off the medications, then they lose the hypertension. So we had many cases in the past where people are on medications, including hypertension medications, without having hypertension.
Oh,
And so
wow.
what is a heart medication going to do when your heart is not sick and you're
Yeah.
taking a heart medication? That's going to get you into trouble. And it's some of
Yes.
them can damage the heart and cause permanent lifelong damage to the cardiovascular system as well. So we have problem of the drugs that
Mm,
migraineurs are getting, which have nothing to do with migraine.
hmm.
And so basically, they're just throwing at all kinds of medication to see what works, but nothing actually works. Not even
Mm,
the newest CGRP inhibitors, even they don't work because all they really do is they target the pain sensory neurons that are
okay.
outside of the brain. But what if you have a migraine without pain?
Yes.
What are you targeting? And also pain is just one symptom. So all migraines come with a host of other symptoms. So
Yes.
assuming you remove the pain, but what about the other symptoms? So
Yes.
there are no medications out there. So salt is fine. Blood pressure is low. So, and I'm
Mm.
sort of kind of channeled off to a different subject, getting back into a
No,
previous.
no, it's very interesting. What about those people who have metabolic syndrome as well? Would they, and they get migraines, they have high blood pressure because of metabolic syndrome?
Yeah, so metabolic syndrome itself, by definition, is a cardiovascular disease. And
Okay.
that goes hand in hand. So when you're talking about metabolic disease, the first signs of metabolic disease is usually, for most people, not for the general science, but for most people, the first symptom of metabolic disease is that people get to gain weight, right?
Yes,
So
that's right.
if you're gaining weight, that's going to put pressure on your cardiovascular system. So, and also the reason why you gain weight is the increase of insulin, the increase of glucose in your blood. And these are inflammatory for your
Mm-hmm.
vascular system. So this is an immediate sign for cardiovascular damage.
Mm-hmm.
Now, I have to say that of all the people who have ever entered the Stanton Migraine Protocol group on Facebook,
Mm-hmm.
and we are very international. I think we now
Mm-hmm.
have every single country just about
Yeah.
in the group. And in every case that I have so far, maybe I would say the total of maybe 3 times, I had a person come in who did not have metabolic disease, like maybe 3 people out of the 17,000. So you're talking about everybody having metabolic disease
Oh,
because
wow.
migraineurs are so carbohydrate intolerant
Yep.
that they will become metabolic disease right away, very
Mm.
early on. And it's not discovered. And they may not get obese or fat. They may not even have high insulin. Many of them come in not even high insulin, like on the scale of the American insulin scale, where the lab ranges are 2 to 24. They may
Okay.
show 4 or 5. So they're very well within the absolutely good and normal insulin,
Yeah.
2 to 4 is the range, and they're 4 and 5. That's very normal, right? Some of
Yeah,
them are
that's
as
pretty
low
good.
as 2.
Okay.
But when you give them the tiniest of carbohydrate, their insulin goes sky high. They have this hyperinsulin response.
Wow. Wow.
And the insulin, when it drops after they finish, it's on for a very long time. And I also checked the C-peptide, which comes with the insulin at the same time. And
Okay.
so you can also, and I would have them take the 5-hour test, prescribed by a doctor. So I would just ask the doctor to prescribe it.
Yep.
And they would take the blood glucose, insulin, and C-peptide all through the 5 hours.
Yep.
And you can see that they may even start with insulin and C-peptide normal, but they may start even insulin below the normal. So if 2 to 24 is a normal, they may start
Mhm.
at 1.8.
Okay.
So you would think that they may even go to late onset type 1 diabetes because they're below in insulin. But
Yep.
they eat a meal, a low carb meal
Hmm.
with very little carbohydrates, and their insulin spikes way up
Okay.
to higher than the maximum for the normal and
Wow.
stays high for like 3-4 hours, and then it starts coming down, and then it crashes. The insulin crashes
Okay.
to lower than the normal, lower than what they started out with. So they have a hypo. It's really interesting what pattern. And we had 2 or 3 people do this test, which is a very expensive test because no insurance will cover this. So they had to pay out of pocket.
Wow.
And all of them were exactly the same.
Wow. So most migrants can't eat carbohydrates.
They can, but very limited. So at the beginning, when we started, the migraine group now is over 10 years old. So when
Yep.
we started at the very beginning, I used to run a carbohydrate threshold test.
Okay.
So that was when they would be following instructions to how much carbohydrates to eat. And so they had a choice between a certain gram of blueberries or a certain gram, 1 cup, a very specific gram of unsweetened cranberry juice. And so
Hmm.
they would have a choice which one they would
Yep.
drink,
Mhm.
and they would not eat at this time. So this was like a very modified glucose tolerance tests just with these foods. And
Yeah.
so we were looking to see blood glucose and blood ketones to see what actually happened, but we also looked to see how they felt. And
Hmm.
so one of the first signs for migraineurs when they eat carbohydrates is that they immediately get edema. Like if I were now to eat any kind of sweets, within 5 minutes, I will feel my ankles will swell
Wow.
within a
Okay.
couple of minutes. And
Yeah.
so for me, this is going to happen from 5 carbohydrate grams, so about 1.25 teaspoons sugar. Okay. And so we ran this test to see at what point did these migraineurs start feeling the same,
Hmm.
and did they get a migraine? And if they did, when did they get the migraine?
Mm,
And
mm,
so based on this, we discovered that the maximum amount of carbohydrates a migraineur can take, any migraineur can take
hmm
without having a
hmm
migraine, is about 12 carb grams. That's
Wow,
it.
that's not much at all.
That's not much at all. And
No.
so now they can take more, but then they have to take salt, they bit of water, they have to follow what I call the how to eat carb guide,
Okay.
which is in the group. And so then they will follow that. And so, but this was a very important test because it showed me how carbohydrate intolerant we are. Like if I give my husband, we had some watermelon at home, and I said, okay, I don't want to eat it. I don't want to see it. It's summertime. I always experiment with eating carbohydrates to see if how I changed.
Yep.
And you remember when you were here, I actually
Yes.
ate dirt as well because I wanted to
Yeah.
see how I was responding to it.
Yep.
But I said, I don't feel like eating it. So my husband ate it. It was a big container. So that was maybe about 200 grams, 250 grams of watermelon. So that's a good amount of carbohydrates, right? He ate it without a problem.
Yep. Yep.
If you had given me 1/4 of that, I would have been in problem.
Wow.
See,
That's amazing. That's very, very interesting. It's all genetics.
it's an eye opener how different we are.
Yeah, yeah. So I suppose the standard protocol would be very, very low carb ketogenic diet or
Okay,
carnivore
no.
diet?
So
No?
this is where so this is where the tricks are coming in because over the many years that we evaluated all this, and we had a lot more people, but a lot of people come and go. They go back to work and then they leave the
Hmm.
group. I estimate we had probably over 25,000 people total with
Oh,
whom
wow.
I worked, okay, over the years. And so basically what happens is that if you take a person, a migraineur, just a migraineur, not other people, but it's just very specific to migraineurs. If
Hmm.
you put a migraineur straight from the standard American diet to a ketogenic diet,
Hmm.
they will experience sugar crashes
Mm.
like you haven't seen before because of the hyperinsulin response. Even if they have normal insulin, they eat 5 grams of carbohydrates, their insulin goes sky high. And when it comes down, I mean, it's just going to be a nightmare and they're going to end
Hmm.
up with a sugar crash.
Hmm.
We have tested also sweeteners like stevia and erythritol, these kind of completely artificial sweeteners. And same thing, they would have that with, say, just a black coffee with a little
Hmm.
stevia in it. Within 2.5 hours, a spectacular sugar crash. So
Hmm.
we are so different that you can't just apply the standard diet change like you do with other of your patients.
Hmm. Hmm.
I have two groups actually. So I'm not
Hmm.
sure if you even know that I have a keto group as well. It's not
Mm.
popular because most migraineurs don't actually like eating the ketogenic diet. It's much
Okay.
more preferred to eat the carnivore diet. And so there are two reasons for this. One is that a carnivore diet for migraineurs is the best diet. It seems to reverse all metabolic disease very quickly.
Hmm.
And because it has no carbohydrates directly,
Hmm.
it stabilizes blood glucose. And since
Hmm.
migraine sufferers get a migraine from a sugar crash, if they
Mm.
don't have a sugar crash, then they're okay. And
Yep.
so it also reduces the chance for the loss of sodium and it allows their brain to function properly. And it's also very easy to do, right? You don't have to worry
Yes.
too much about what you have. And in my group, we're very specific about what macros they eat. So
Hmm.
how much protein versus how much fat and all that, because as opposed to other people, like if you go carnivore, you can just simply eat a slice of meat without any concern to how much fat or protein is in
Mm-hmm.
it.
Yep.
And not so for a migrainer, because if there's too much fat and she doesn't get enough glucose from the protein, like if she eats a lot of protein, the
Mm-hmm.
excess protein after protein synthesis is going to convert to glucose.
Yes.
We are counting on that because that has a stabilizing effect of her glucose while she's still in metabolic syndrome and has difficulty
Okay.
otherwise to manage the insulin and the glycogen and the ketones. And so we don't actually really want her to be in ketosis. I'm saying her because 95% of the migraineurs in my group are female.
Okay.
Um,
Yep.
and so we don't want her to be in ketosis
Mm-hmm.
because it can cause blood sugar variations for her between
Mm-hmm.
eating and not eating. And
Mm-hmm.
furthermore, medications interact with some of them
Mm-hmm.
interact with ketosis. For example, topiramate, Topomax is a
Yes.
medication that most migraineurs just get. That's just a given. And that one has a black box on it. I don't know if you are familiar with the label black box, which was put on, I think, 3 or 4 years ago, which says do not use a ketogenic diet
Oh,
if taking Topomax because it causes kidney stones. Now, whether this kidney stone is because the general ketogenic diet is not properly prepared with electrolytes, I don't know. Because you need to drink electrolytes and be properly hydrated to prevent kidney stone. Or
yes.
because it is full of high oxalate vegetables, maybe,
Could be.
which
Yes.
many of the ketogenic diets are. So I don't know if it really has anything to do with Topomax, but the
Okay.
label says it does. And so I'm not going to take any chances. So a migrainer
Sure.
coming in who's on Topomax has to sign a waiver that they know that there is this interaction and we don't want them to be in ketosis. And so they
Okay.
have to monitor their macros to prevent ketosis.
Oh, wow. That's amazing. So would they go on a carnivore diet and have enough protein so they don't go into ketosis?
Right. So we overload protein on the high end.
Okay.
And that way, we all have a protein synthesis maximum that we can do.
Yeah.
So there are two parts to protein. So you have to have a minimum amount of leucine to
Mm-hmm.
start protein synthesis, and that's
Mm-hmm.
age dependent and activity dependent. It's not
Mm-hmm.
gender specific, but it's age and activity specific. So the older you get, the more leucine you have to have. And leucine is a branched chain amino acid
Yeah.
that is participating in. Basically, it's a signal for the protein synthesis to start.
Mm-hmm.
And so when you have enough leucine in your body in one particular meal, so it's a bolus amount that you have to eat pretty fast to make sure that it's in your blood all at once, then protein synthesis will start if you meet that. So for example, for
Mm-hmm.
my age, given that I'm over 70, so I would have to have a much larger leucine, 4.5, 5 gram, maybe even more. So I have
Okay.
to eat a lot more protein than for example, you have to eat to get there to start protein synthesis. But then there's a limit to how much your body can synthesize, and that too is age and activity dependent. So the older you are and the less active you are, the less you can synthesize because you
Yeah.
simply don't have enough capacity. And so once you reach that maximum, whatever protein you still have or amino acids you still have in you, they will convert to glucose because out of the 20 amino acids,
Mm-hmm.
2 are ketogenic, but the rest of them are glucogenic. And some of them can go both glucogenic or ketogenic. But once
Okay.
your protein synthesis is over, they're just going to convert to glucose. And so that glucose, though, is as needed. So it's by demand. So it's not like sugar that you eat, which immediately has to be burned up.
Yep.
So
Yep.
this is a little bit different. It's a slower process.
Yep.
Not too much slower, but it's still a slower process. And so this can then hold off. It can stabilize blood glucose and allow the
Mm-hmm.
body. It's still not as good as, say, fasting or other things. But at the beginning, when the person can't yet do a fasting because of the ketones that we want to avoid, the state of
Mm-hmm.
ketosis, or because they're just simply crash from a fast,
Mm-hmm.
then this can provide enough glucose for them all through the night, for example, for sleeping.
Mm-hmm.
Because most migraines, a very large percent of migraines actually
Mm-hmm.
start in the down phenomenon time of the day, which is around 3 to 4 a.m.
Mm-hmm.
So that is when a huge blood glucose variation happens, because all the stress hormones are released at the same time to help the body and the organs wake up. So it
Oh.
releases a lot of glucose via
Mm-hmm.
glycogen. And that glycogen also is a glucose. It will also act as carbohydrates. And
Mm-hmm.
so many migraineurs will have a sugar crash. And so when you have a
Wow.
sugar crash in the morning, you're going to wake
Mm-hmm.
with a migraine. But if you eat a little bit of protein before you go to sleep, and
Mm-hmm.
if you have a lot of protein all throughout the day, then you can prevent this because you're
Mm-hmm.
not eating carbohydrates, just protein. And so you totally, and so I'm looking for a higher protein dose and fat dose.
Mm-hmm.
Whereas
Yep.
you or other people would be looking for equal fat to protein or a higher fat than protein. But in my
Yeah.
case,
Yeah.
I'm looking for a higher protein than fat. So it's a
Yep.
different kind of a macro. And that seems
Mm.
to work pretty good. It's harder to eat because there isn't as much fat and may not be
Yep.
as tasty, but it's works very fast to
Mm.
help
Great.
people.
So as you said about fasting, so you wouldn't recommend fasting for migraineurs?
Not while they still have migraines. So once, and we keep on running a test in the group for all the migraineurs, and this test is Kraft equivalent. So the Kraft,
Mm-hmm.
Joseph Kraft had this. He ran an oral glucose tolerance test and checked blood glucose and blood ketones for 5 hours.
Mm-hmm.
So I'm not a doctor, so I can't order the migraineurs to
Yep.
get this test. But what we do is we do a 5 hour test.
Mm-hmm.
They tell me what they ate. So they have to give me the macros very precisely, everything that they ate.
Mm-hmm.
And it is a 5 hour test in which they're running blood glucose and blood ketones, because blood ketones can be used as proxy for
Mm-hmm.
insulin. And
Yep.
so in running this test, it tells me whether they are ready or they aren't ready for fasting or some other
Ah,
methods. And so we run
okay.
this many, many times over and over. The same person will run it as often as they want to run it. And
Wow.
then you can see the improvement. So they get a copy and I have a copy of what they have. And then over time, this improves tremendously. So you can see how their blood glucose stabilizes. The beginning is like a big roller coaster, maybe a couple of sugar crashes spiked in between. And then as they improve, there will be a very high blood glucose, and then there will be more sugar crashes. And then pretty soon it's going to sort of kind of stabilize. And after a
Okay.
while, you're going to see, like I just did one couple of days ago, he was nearly a straight line. And
Wow.
so that was a perfect, and he's on the carnivore. So, and at that point, I said, okay, so you're stable now. Let's see if you want to, you can go and experiment. So you can join the keto group.
Okay.
And then first they change the macro. So I start putting them toward higher fat to
Okay.
see if the higher fat, they're still not eating any carbohydrates, but the higher fat, to see if they can tolerate it. Many people at this point revert back to being bad
Yep.
and then stop and they go back into, and they have to stay longer on the higher protein diet. And then they
Okay.
try again. And in time, they can tolerate the higher fat. It's really interesting to
Wow.
see how the body works. And then I recommend that they try a hypercarnivore. So hypercarnivore is the higher fat carnivore, where they
Mm-hmm.
can add a little bit of plants, such as, say, a pickle for a burger, or
Okay.
a tomato or something minimal, just very
Yep.
minimal, just to get
Mm-hmm.
them used to, even to rebuild the gut flora and to get them used to the plant and see how they respond. If they
Mm-hmm.
relapse, then back again to carnivore and
Okay.
be on the carnivore for longer. And so in time it builds up, and then they reach the point that they look perfect and they can start ketogenic diet. And once they start ketogenic diet and they're stable, then I say, okay, they're ready for time restricted feeding, intermittent fasting, 3 day fast. Now I don't allow them to fast longer than 3 days though.
Mm-hmm. Yep.
And that's because migraineurs have low blood pressure, as I mentioned at
Mm.
the beginning.
Yes.
And when you fast, the first thing that changes is your blood pressure drops. And so if they go for 3 days, on the third day, they have to check their blood pressure regularly. And
Mm-hmm.
if for whatever reason, like I had to go past 3 days a couple of times when I had COVID and I couldn't eat anything. So I
Mm-hmm.
fasted for 5 days.
Wow.
You have to have somebody with you, because if you pass out from low blood pressure, I mean, my blood pressure goes down to 80 over 50. So
Mm,
that is like subclinical. I mean, it's
very
really into
scary.
tachycardia, right? So it's really
Yes.
not safe. And so you can pass out and who knows what happens. So you have to have somebody with you who knows what to do,
Yep.
who's trained. And so in my case, my husband is trained, and so he knows what to
Yep.
do.
Yep.
And in other cases too, I would talk to the migraine that, look, you need to talk to your doctor. Like, for example, with the first case when I had COVID, I went into the emergency. I said, check me, because I just want to make sure that I'm hydrated properly, because I'm now day 5 of
Mm-hmm.
not being able to eat anything. And so not my choice to do a 5-day fast.
Mm-hmm.
And so they checked, they said, no, you're fine. You're fully hydrated, blood pressure low, but fine. You can go home. And so then I know I'm fine. So as if they have somebody to check, fine. But
Mm-hmm.
otherwise, I prefer to just within 3 days. But it takes some time to build them up to being able to do it.
Mm-hmm. Wow, that's amazing. So, in summary, migraine Stanton migraine protocol, it'll be electrolytes management and diet management. And what else would you say, Angela?
Well, I think it's important to also add how you would have to. Migrants are extremely sensitive to their environment. So we have a lot of very athletic migrants. Some of them are competitive athletes, like marathon runners, weightlifters, swimmers.
Mm-hmm.
And so it's important to understand how to manage sports and activity. It's
Okay.
also important to understand how, for example, weather may participate in how migraine is, because everything that changes in the electrolyte, or
Yeah.
can change the electrolyte, will change the electrolyte for a migrainer. And so
Mm-hmm.
the most expert of migrainer can come down with a migraine if the weather suddenly changes and the pressure drops or increases without planning. And so uh, I would like to add, for all migraineurs who are going to watch this,
Mm-hmm.
that they need to be, first of all, aware of what happens to them. So, for example, women will have the menstrual cycles.
Mm-hmm. Yep.
And in the cycle, we have estrogen and progesterone
Mm-hmm.
taking places,
Mm-hmm.
changing places. And estrogen recycles sodium in the blood, in the kidneys. So it
Mm-hmm.
retains water. So women can, for example, prevent a migraine during their menstrual cycles by measuring themselves every single morning before they eat or drink, and see the change. So if from one day to the next day you suddenly gained 2 kilos or a
Mm-hmm.
kilo,
Yep.
you're estrogen dominant. You've retained a lot of salt and water.
Fluid.
And
Okay.
so
Yep.
at
Yep.
that point, you don't want to add salt and water
Okay.
more. You want to cut it completely out
Yep.
and increase the potassium in your diet. So eat the avocado, eat the steak or fish, which are
Mm-hmm.
high in potassium, and don't salt them. Just eat that. It's going to pull all the water and salt out of you, balance it
Mm-hmm.
out, and you can prevent the migraine. But if you dropped a lot of weight, then that means your progesterone is high. And
Mm-hmm.
so then you want to increase salt and water. So there are little caveats all through, or say, for example, weather.
Yep. Yep.
You have a huge weather change, and,
Mm-hmm.
and say hot, suddenly it becomes very hot. Well, what does that mean to a migrainer?
Yep.
The strong heat basically dilates your blood vessels. The blood vessels literally come closer to your skin,
Mm-hmm.
and you
Yep.
can see
Yes.
them pop out, right? So
Yep.
they dilate. So
Mm-hmm.
when the blood vessels dilate, that means that whatever blood level you had is just now much lower, because your blood
Mm-hmm.
vessels are much bigger. So now you
Mm-hmm.
need to hydrate. But
Mm-hmm.
if you're going into a cold environment and your blood vessels disappear,
Yep.
everything, they all move deeper inside to prevent evaporation and
Mm-hmm.
to prevent heat loss. Then you don't want to hydrate, because now your blood vessels are constricted. So now you
Mm-hmm.
want to actually stop salt and water and eat your avocado or meat, beef or fish, because that's potassium and it's going to release the excess sodium and water. So you
Mm-hmm.
continually have to watch and balance. Now, this gets better over time.
Yep.
Like
Yep.
after, I would say, 6 years of doing what I was doing, I'm no longer sensitive to, for example, pressure changes
Okay.
or temperature changes. So it's sort of kind of your body learns to accept and to adjust on its own to it.
Mm.
But you have to give it some time. And the
Is
same
it
thing with exercise.
is it your body healing from the metabolic
Yes,
instability as well?
I think so. So I think it's your resistance increases, and so you are in a better place, and you can tolerate a lot more before you sort of kind of fall apart, and
Great. All right, that's amazing. That's so much information. But you are amazing at 70. Tell us just a little bit of tips on how you manage to not age at all.
Oh, well, I do age. It just takes a little bit longer work every time to not show it. But I think it's just a diet, obviously, tremendously helps. I sort of kind of
Mm,
now I'm diverting because I'm doing a lot of experiments and I wanted to gain weight so I can see what happens if I, for example, start eating allulose. I wanted to see that's a
okay.
sweetener that is supposed to help a little bit. So I wanted to see, is it true? And if it's
Okay.
true and if it doesn't cause migraine, maybe the migraineurs can. So I already put it in the group to see, if you feel up to it, start experimenting and let's see how it works for us. But otherwise, you keep active. I mean, I'm
Mhm.
still studying every single
Wow.
day. I'm very much into not just nutrition and migraine, but also quantum theories and
Yes.
a host of other very fascinating stuff. So stay active in brain and
Yeah.
stay active physically. I know you run, right? You run marathons and
Yes, yes, that's
see,
right. I run quite a
fantastic.
bit.
Yeah,
Yeah,
so that's how it starts. You have to stay active and then do that. And I think that will keep you as young as you can be.
absolutely. Yeah. I'm looking into a little bit of on circadian health and getting outside, try and watch the sunrise, sunset, and getting light into the eyes. Yeah.
I'm told it's good. I never wake up early enough because I'm a night owl. So I work till
Oh,
one,
okay.
2 o'clock in the morning. So I don't ever see that. And I
No?
still seem to be okay. So I don't know about that, but it might be, dependent on the person. I don't seem
That's
to
it.
need that.
Yeah, different people.
Yeah.
But that is fantastic information, Angela. Tell us where people can find you if they want to join the group. How do they join the group?
Oh, yes. Let me actually tell you, I never know how to join the group. Let me open it up and see what the name of the group is. And so the name on Facebook is called Migraine Sufferers. So it will be facebook.com/groups/migraine sufferers. And they can also find me on Facebook if they use my full name with Angela A. Stanton, PhD, just like you have on the screen. And
Yep.
so that would be my personal account. And then they can go from there. And on Twitter or now X, I am at Migraine Book. And they can find me on LinkedIn. They can find me anywhere. And of course, there are a lot of YouTube interviews with a lot of people. So if they just put my name in YouTube, a lot of interviews will
Yeah,
come up. So they can get a hold of me everywhere.
great. I'll put all the links on the show notes.
Thank you.
Thank you so much for your time, Angela. There's so much information.
Thanks. Thanks, Avi. It's so nice to have chatted with you. Thank you.
Thank you. Thank you for tuning in to another episode of Prescribing Lifestyle. We hope you found today's discussion insightful and motivating. Remember, your health journey is a marathon, not a sprint. Implementing small, sustainable changes over time can lead to sustainable improvements in your well-being. Remember, these podcasts are not to be treated as medical advice. You should see your own doctor for medical treatment, or you can come in to see me in my clinic in Melbourne Low Carb Clinic, face-to-face or telehealth Australia-wide. If you have enjoyed today's episode, please subscribe, rate and review us on your favorite podcast platform. Your feedback helps us reach more listeners and continue bringing you valuable content. I also want to invite you to head to the website of Melbourne Low Carb Clinic to download a free ebook and join my free community on Facebook. Stay connected with us on the socials. And don't forget to share this podcast with your friends and family who might benefit from our discussions. Until next time, keep prioritizing your health and embrace the power of lifestyle medicine. Take care and see you soon on Prescribing Lifestyle.